Hello, my name is Tidra Lockin, and today is Friday, March 29th. So today I'm going to be demonstrating how to give insulin through a pen, as well as how to mix our NPH and our regular insulin. So first, I'm going to go into the med room. I want to check the patient's blood glucose before going in, so I could know how much insulin I'll be given. So the patient's blood glucose is already checked, and I'll be given 5 units of insulin through the pen. Gonna go ahead and put my gloves on. Okay, I'll go ahead and take my pen out. I'll make sure to twist it 10 to 15 times. Then I'm gonna go ahead and check the expiration date and make sure that it's not cloudy. I'll go ahead and wipe the tip of the pen. After wiping the tip, I'm gonna go ahead and screw my needle on. I want to make sure to prime with 2 units first. I'll go ahead and take that off. Okay. Once it's primed, I'll go ahead and adjust it to my 5 units because that's what I'll be given. Then I'll go ahead and scoop. Now I could go ahead and go into my patient's room. I'll make sure to provide privacy. I'll put on clean gloves again. I'll also make sure to confirm the patient name and date of birth, and I'll also check it on the pen as well. I'll go ahead and make sure that I'm rotating sites as well. So I'm gonna go at the abdomen. So as I said before, make sure to confirm the patient name and date of birth. I want to make sure to wipe the site, and I'm going to make sure that it's air dry and I would not fan or do anything. Then I'll go ahead and administer the insulin. I'll hold that for 5 to 10 seconds. Then I'll go ahead and pull that out. I'll go ahead and scoop, then close it. Then I'll go ahead and screw this off. Then I'll put this into the sharps container. Being that we're gonna use this again for future videos, we'll not do that. I'll cap this on, and then I'll put this back in the fridge. Now I'm gonna go ahead and demonstrate how I'll mix our NPH and our regular insulin. So I'll go into the med room. I'll always wanna make sure that I know the patient's blood sugar. And right now we're gonna be given 4 units of regular insulin and 8 units of our NPH. So I'm gonna go ahead. I'll make sure to twist our NPH 10 to 15 times in my hand. I'll go ahead and wipe the boat covers. I'll have my needle ready. So I'm gonna pull back 8 units of air. Then I'm gonna go ahead and put that into the cloudy. Then I'll go ahead and pull back 4 units of air and put that into a regular insulin. Now I could go ahead and pull that up. I'm making sure to get my air bubble out. Then I have it at 4 units. And then being that the needle is a little bit bent, I'm going to try and straighten that out while going in to our NPH. Kind of get it straightened up a little. And now I'm going to pull back 8 units, so I'm going to be ending up with 12 units. I got to make sure not to pull back, not to push back into this valve. So I'm pulling up 12 units. Okay, and I want to make sure that all the air bubble is out. Then I'll go ahead and recap it. Once the needle is covered, then I could go ahead and do that. Then I'm going to go ahead and go into the patient's room. I'll make sure to provide privacy again. I'll check to confirm that it's the right patient. So I'll ask the patient for their name and date of birth. I'll go ahead and put my gloves on. And then I'll make sure that I'm rotating the side as well. Also, when given insulin, we want to make sure that the patient tray is there or they have eaten already. So I'm going to go ahead and wipe the site. I'm going to make sure that it air dries. I'll tell the patient what I'm going to be doing and what I'm giving. Then I'll go ahead, make sure not to touch where the needle is. Pinch the skin. Go in. This one we don't have to wait. Then I'll go ahead and recap the needle. Then I'll put that into the sharps. I'd make sure to document how the patient took the procedure, took the insulin, if there was any complaints. I also want to document the site where it was given as well, so the next nurse would know how to rotate. And that will be it.